Sacrum is triangular in shape. This is the lower part is called the apex. The upper part is called the base. It has two surfaces, anterior and posterior. The anterior view, this flat area, this is called ala or wing. These bony prominence that you see, these are actually the fusion of the vertebrae, so now it's ossified. These are called transverse lines or transverse ridges. Also, you can see laterally, these openings are there. These are called sacral foramina. Sacral foramina contains spinal nerves. And posteriorly, if you look at it in the middle, this is the entrance of the sacral canal. This is the continuation of the vertebral canal. So the content of that is the spinal nerves. There's actually different names for it, but I will not give you that much detail or go into that much detail. It's actually part of the spinal nerves, but just right now know that the spinal fibers. Okay, and here these fibers are coming out or may enter the spinal cord. It depends on the type of the function that they have, and this area is called the sacral hiatus. There is also some bony prominence here that is in the middle. It's called the medial sacral crest, and laterally you have the lateral sacral crest. Different muscles and ligaments and tendons attached to that area. You have the sacral foramina similar to the anterior view. And also you have the sacral tuberosity, this area, and the articular process. So this articular process, this is the one that I told you before, that articulates with the L5, which is the lumbar vertebra, the last lumbar vertebra. Lower part of the sacrum also articulates with the coccyx, and as you can see, there's different vertebrae, they are fused together. This is the lateral view. So this is the base, and this is the tip of the sacrum is around here. And important clinically, this area is important. This is called sacral promontory. So what is the sacral promontory? Let me go back and show it to you again here. This is the sacral promontory. So it's located in the base. So if it is very anterior, that is not a good news for a woman, because during labor, the head of the baby cannot come down. So the vaginal delivery cannot happen, and the person has to have C-section. So it has to be a little bit backward. In men, it does not really matter, but in women, it's really important. This area that you see, this is called auricular surface. Auricular surface. And that is an area that is connecting with one of the hip bones. That's called ilium. And ilium is written with I. And I will come back to that on chapter 8. I will show you again the articulation. You can see this bony prominence a lot easier from the side view. So this is the median sacral crest, and this is the lateral sacral crest. Okay, and there is also the curve there. So this curve is not important in men, but again is more important in women. In men is more located anteriorly, but in women it should be like this. Okay, more inferiorly. If this is too anterior, then again the head of baby cannot come down, it's stuck here, and the person has to have surgery.